Hi, my name is Pam and welcome to my channel. And if you don't already know, this channel is about me and AML. Today I'm going to talk about my diagnosis and what went on about me finding out I had AML. So before I start, I just want to say one thing about the date of my diagnosis of AML, which is March 5th, 2019. 4 years before I got AML, I got a diagnosis of polycythemia vera, which is another type of blood cancer, I guess. And there's no cure for that. And it was pretty much completely controlled. I would go into the doctor. At first, it was pretty scary, but I was getting these phlebotomies pretty much weekly while they got a hold of that disease. But after a few months went by, it was pretty standard, and I would just go into the doctor, my hematologist, every month or two, and he would do a blood test, and if I had a hematocrit that was high, he would do a phlebotomy, which is taking blood out like you're giving blood. That's the only way to control it. And I just went along like that, and everything was pretty much status quo on that for 4 years. There was a little bit of a mention when I first got the polycythemia vera that there was some slight 2%, less than 2% chance, super rare. The polycythemia was rare at the time, but super rare chance that it could morph at some point into something like leukemia. But I sort of didn't really want to think about that too much. I had enough on my plate just thinking about the polycythemia vera, and so I pretty much discounted the 2% chance of the leukemia. So, flash forward. So what happened was this year, in March, my husband and I were planning a vacation to Florida and get out of the winter of, we live in New York, in upstate New York, and it's pretty cold and dreary all winter long here. So we planned a trip to drive to Florida and New Orleans and San Antonio, Texas, and it was going to be yay fun. Visit my husband's brother, and so I had a couple of routine doctor's appointments set up before that trip. So one of them was February 12th. I went in and to the hematologist, and he did the blood work and said I didn't need to have a phlebotomy, and the hematocrit was under control and everything looked under control, except my platelet count had dropped quite significantly. And he didn't seem to think I needed to do anything right then and there about it, but he wanted to see me in like a couple of weeks, and I told him that we had planned this vacation and we were going to be gone in a couple of weeks, and he said, okay, we'll come in right after your vacation and we'll see where we stand on this platelet drop. And so I was like, okay, what do I know about platelets? But actually, when we got home from that, my husband was, unbeknownst to me, sort of worried about that news. And he tried to get me into, or see if he could get an appointment with a doctor, a specialist in polycythemia vera and leukemia, even though there was no mention of leukemia. But maybe my husband did some research and saw something there. And he tried to get me in to see one of the top doctors in New Haven, Connecticut, in Yale, at Smilo Cancer Clinic. But I did have the polycythemia vera, and this doctor was a specialist in that. So, okay, moving on. The doctor said, no, we can't take patients. Their offices said, we don't just take patients that call up like a regular doctor's office and ask to come in and make an appointment. I guess you have to go into this clinic in New Haven under different set of circumstances. It's not like you're your doctor, your primary care doctor, or any of that. So, okay, my husband decided he would wait and put that on hold until we got back from our vacation. So, 2 weeks later, we were gearing up and getting ready for the vacation. 2 weeks later, I had a routine doctor's appointment with my primary care doctor. So I just see her every 6 months, and she monitors my blood pressure and stuff. So I went into her, and first thing I did was I told her about the platelet drop and just what was going on in my life. And she was the one that got me to see a doctor about the polycythemia vera. She noticed it first. So I also showed her this thing on my foot that I thought was a spider bite, because we live out in the boonies, and I had been trying on shoes to kind of wheedle down the content of shoes in my closet. So I'd had my foot in a lot of different shoes, and who knows, I just got it in my mind that maybe there was a spider in one, and I had this kind of bruisey bump. It wasn't very big on the top of my foot. So I showed her that, and she immediately said that was not a spider bite. And so we talked, and we talked about my blood pressure, and everything seemed fine. And so she said, well, I want you to get some blood work, and then as part of this appointment, and then you can go on home. So I went down, got the blood work done. We got in the car and went off. We were going to actually somewhere to pick up some prescriptions to take on our trip for my blood pressure. And about halfway into that trip, I get this call from the doctor herself, which when the doctor calls you herself, that's usually not good. They usually have someone else call to tell you stuff. But if the doctor usually calls you personally, you can just pretty much brace yourself. That's what happened with the polycythemia vera. So she goes, we found something in your blood that doesn't look good at all, and I want you to stop right now what you're doing and turn around whichever direction you're headed in and get yourself over to the emergency room in the biggest local hospital out where we live. And so she didn't really say anything about what it was or anything. She just said, go there. And so we stopped everything. She said, grab a suitcase from home and take a couple of things with you. Kind of weird. So we ran home, and I grabbed up the suitcase that I was using to pack for our trip in the sun, which had a bathing suit in it, which was totally unuseful, proved to be later. Anyway, I got to the emergency, and normally when you go to an emergency room, you sit around for a couple hours. I don't know how many of you have ever been in an emergency room. I've been in them a couple times for different things, but you usually sit around a lot. So I walk in, and they are like waiting for me. So that was like, that was weird. And so I didn't wait 1 second. I went from standing at the counter saying my name and who I was to right back into a room in the middle of the emergency room area. And there was like a lot of people around humming and looking at me and attaching things to me and taking my blood and looking at different readings of things. And, there was enough people around there. And it's weird because I don't even feel like, I can't even remember. I must have gone into complete and total shock when that happened, because I remember a couple of things that were going on there. And I remember a girl trying to put a EKG lead on my stomach and was pushing so hard because it wasn't connecting. And I was like, ow. And, but that's about it. And I just can't remember all that fluttering around me. And I don't know what I was thinking. I think I was just starting to like go into shock or block this stuff out. I don't know. And then this doctor comes up, and he stands at the foot of my bed, and my husband is next to him. And he said that he didn't think there was nothing they could do for me there. He knew that there was nothing they could do for me. And I was like, trying to like process that. And he was like, you're going to have to go somewhere else to be taken care of because we can't take care of you here. And I swear, I think my husband was starting to cry, and I feel like I looked over in the corner and I saw the like dark shape of the Grim Reaper. I don't know. I feel like a blank, and I just remember everything sort of in weird slow motion. And so that doctor was asking my husband and me, which I was sort of like oblivious of where I wanted to go, or where, he started to name a couple of places where to go, but and my husband didn't like the sound of some of the places that he was recommending, other hospitals. And so my husband was like, well, I would like her to go to New Haven, Connecticut, to this Dr. Podoltsev was his name. It was the one that my husband wanted me to see if I had ever got over to New Haven. And so that doctor, the emergency room doctor, said, okay, he would call up over there at Smilo Cancer Clinic, which I wasn't even registering that it was a cancer clinic, and I didn't have the slightest idea still of what I had, or but maybe my husband was more filled in on it. But anyway, the doctor called the Smilo and asked if he said he had a patient, and explained to the doctor, I guess, more stuff than I got the news of what was going on with me, and would he see me? And so the doctor in New Haven, Dr. Podoltsev, said, yes, I will see her, and I want you to put her on a helicopter right now, immediately. And I'm like, oh my God, I've never been on a helicopter in my life. And they started getting me all ready, and they told me they were calling this helicopter and it would be there any minute, and that my husband really couldn't come with me in the helicopter, which I was petrified of because I just never been in a helicopter before. And I actually, truth be told, I never wanted to go in one either. Seen too many accidents or whatever. So I was like very nervous about that, still in the fog, or just completely blocking out everything about what could be wrong with me and why I wasn't even questioning why I was going off in a helicopter. And like I asked the emergency room doctor if I was going to make it, and he looked at me and said, I don't know. That's like totally, does wonders for your day. And I was like, well, you mean I could like die? And he was like, I don't know. Let's just get you on this helicopter and over there to the specialists. So boom, my husband couldn't come with me on the helicopter because it was too small, and he had the car and needed to have a way to move around once we got there. So off I went in the helicopter, which was an experience. Unfortunately, I didn't enjoy that much. The helicopter guy, I was laying down flat the whole time, and I was with the emergency technician guy that was sitting next to me, and they put those little headphones on me, and he was talking to me, and I was talking to the pilot, and next thing I know, I was like, hundreds of feet in the air, and they were like telling me to look out at scenery, and look, you can see the Long Island from here and all this. And so I wasn't really too plussed about it. But anyway, so off I went and got there in about 20 minutes, unheard of, from where I live to New Haven, Connecticut, and landed on the roof of the hospital. And they took me into the emergency room, and immediately, or pretty soon, really soon after I got in there, Dr. Podoltsev shows up, and he basically said, look, your white blood count is like 400. And it's like, I think it's supposed to be 10,000. Mine was 400,000. didn't mean a whole lot to me, but I do recognize the fact that a normal 10/400 isn't good. So, and they were very concerned about what was going to happen to me and whether I was going to make it or not. And he said I had this thing called AML, acute myeloid leukemia, and that they had to start chemotherapy like right then, as soon as possible. Like I know I was in shock because I just don't even, I hardly remember that stuff. I remember him coming in and I remember him telling me that, and I think I just was like, okay, leukemia, chemotherapy, and hospital. And so anyway, they basically did start this first round of chemotherapy, and I had that. I was really worried about my hair falling out. I already was worried about my hair falling out when I had hair to worry about. But I knew now that any worries of that were like stupid, because now I knew my hair would fall out, which is weird because, you know, you've got bigger fish to fry than worrying about your hair falling out. But anyway, I was worried about it. And like all the things you hear about chemotherapy, and like getting sick all the time and hair falling out, and ugh. So I guess I was up for the challenge. But finally my husband showed up and was there with me in the emergency, and I was getting chemotherapy. I think for sure this time he might have been crying. I never saw that happen on my husband, and it really was breaking my heart. The whole thing was pretty heartbreaking, but anyway, you know, you just move forward. You think it's the end of the world when you get that kind of news, and you realize you just are going to do what they tell you to do and hope for the best. So that was like back March 5th, 2019, and I went from that first round, I think, of chemotherapy. They were in the process of it. That might have lasted like 3 days. I can't remember any of the names of the chemotherapy. All of my chemotherapies were like the standard, whatever they give people when they come in with AML. They pretty much do a standard, I don't know, cytarabine and a couple mixtures, and then you get something called 7+3, which I'm still not positive about what that is. They give you 7 days of chemotherapy and 3 days of some other kind of chemotherapy. They moved me after like, I think 2 or 3 days from the emergency room into the regular hospital, and did more chemotherapy. And then what they do is they give you chemotherapy, and then you wait to see what happens with it. And so that's what I did. I waited. And I think I'll end this right here because it's already too long. Sorry about that. And the next video, I'll talk about what happened to me in those early days when I was in the hospital, and what kinds of things the doctors were telling me that I needed to look at and think about. And I'll leave you with that for right now. And have a great day. I hope this wasn't too long and painful.